Bismillahirrahmanirrahim. Quote of the day is choose to be optimistic, it feels better. Uh, my name is Dr. Aamna Khalid. I'm PGR Community Medicine. I will be presenting the topic of measles under the kind supervision of Professor Dr. Saira Afzal, who is Dean Institute of Public Health, Lahore. So the learning outline of today's presentation is there will be introduction to measles, epidemiological determinants, clinical features, phases and complications, diagnosis, prevention and control measures, global data and recent advances, and then we will do the practice of MCQs. So, an introduction to measles. Measles is a highly contagious viral disease caused by the measles virus that's part of the paramyxovirus family. It spreads through respiratory droplets and can lead to severe complications like pneumonia and encephalitis. Despite the availability of effective vaccines, outbreaks persist globally due to gaps in vaccination coverage caused by misinformation and healthcare barriers. So, the epidemiological history of measles. The first case was clinically diagnosed in the 19th century, and the first measles vaccine was developed in 1963. And in Pakistan, the vaccine was introduced into the EPI schedule in 1978 to reduce its burden. Dynamics of disease transmission. The reservoir humans are the only non-reservoir for the measles virus. Mode of transmission is through respiratory droplets, either via air or direct contact. Incubation period is from 7 to 14 days, during which the virus multiplies in the body without visible symptoms. Period of infectivity ranges from 4 days before the rash appears to the 4 days after it. Epidemiological determinants. We will discuss agent factors, host factors, and environmental factors. Agent factors. The causative agent, as we discussed before as well, is the measles virus. That's a member of the paramyxovirus family and it's highly contagious and responsible for the disease widespread transmission. Host factors. Age of the patient. Young children, particularly those under 5 years old, are more vulnerable to measles as their immunity system may not be developed fully or protected. Immunization status. Individuals who are not vaccinated or have not completed their vaccination schedule are at high risk for contracting measles. Environmental factors, living conditions, crowded living environments, poor sanitation, inadequate nutrition, dry winter seasons, healthcare access, limited access to healthcare services and immunization programs, especially in rural or underdeveloped areas, increases the likelihood of outbreaks of measles. So we move to the clinical features. Uh, Fever, cough, coryza, that's runny nose, conjunctivitis representing as red watery eyes, malaise and fatigue, rash, Koplik spots. These are the clinical features of measles. So there are four phases of measles. The first one is the incubation period, then prodromal phase, then there is rash phase, and then there is recovery or complication phase. Incubation period ranges from 7 to 14 days after exposure to the virus, and during this phase, there are no symptoms, and this phase is asymptomatic, meaning there are no visible signs or symptoms. The individual is not yet contagious, but the virus is multiplying in the body. It is important to note that while the person may not feel ill, they are incubating the virus. The second one is the prodromal phase that ranges from 2 to 4 days before the rash appears. Symptoms in this phase are high grade fever, often peaking at 104 degree Fahrenheit. Respiratory symptoms include cough, coryza, sore throat, conjunctivitis. Koplik spots now appear, small white spots with a red base, typically appearing on the inside of the cheeks, that is oral mucosa. This phase, the prodromal phase, is critical for diagnosing measles. The presence of Koplik spot is a key diagnostic feature along with a combination of other symptoms like fever and respiratory symptoms. The rash does not yet appear, making this phase tricky to distinguish from other viral infections. Then comes the rash phase that ranges from 3 to 4 days, and the symptoms of this phase is maculopapular rash that starts behind the ears and then spreads on the face and then downwards on the neck, trunk, and limbs in a cephalocaudal direction. The rash may become raised and red, eventually darkening before fading. Then comes the fourth phase, recovery or complication phase. Duration symptoms usually begin to subside within 1 to 2 weeks, but complications may arise. The recovery phase is marked by the subsiding of the rash and fever. However, if complications like pneumonia or encephalitis develop, further medical intervention is necessary. Recognition of these complications is crucial for proper treatment. So, complications of measles are the early complications and delayed complications. Early complications of measles include otitis media, pneumonia, and diarrhea, and delayed complications include encephalitis, persistent immunosuppression, subacute sclerosing panencephalitis. This subacute sclerosing panencephalitis is a progressive neurological disorder that's caused by inflammation of the brain. It may develop due to reactivation of the measles virus or an inappropriate immune response of the measles virus. The diagnosis is confirmed by examination of cerebrospinal fluid or an abnormal electroencephalograph gram or a magnetic resonance imaging, MRI or CT, that shows brain abnormalities. So, the differential diagnosis uh, pertaining the a rash phase includes varicella, scarlet fever, rubella. So, we have to differentiate these diseases as well. In first of all, we have shown in the picture varicella. The rash in varicella is vesicular and it appears like dewdrops and it spreads from the trunk and then to the face and limbs. And then we have, as you can see that in the picture, we have scarlet fever. The type of rash in scarlet fever is sandpaper-like erythematous and diffuse punctate red rash appears. This rash starts from neck and then spreads on the trunk and extremities. Then we have rubella. The type of rash in rubella is fine maculopapular rash that's pink or discrete. This begins on the face and then spreads to the trunk and limbs. And in case of measles, as we have discussed before, the rash is erythematous and it starts behind the ears and then spreads on face, neck, trunk, and extremities. Measles and pregnancy. Um, in pregnancy, pregnant women, particularly in the first trimester, are at increased risk of severe complications, including pneumonia, encephalitis, and other respiratory problems. Measles can lead to prolonged fever, which may worsen maternal health and increases the likelihood of hospitalization. What risk it causes to the fetus? Measles during pregnancy, particularly in the early stages, may result in miscarriage, preterm birth, or low birth weight. Congenital measles, although rare, but can occur and cause serious birth defects such as developmental delays or neurological damage. So, prevention in pregnancy is vaccination prior to pregnancy is the best way to prevent measles in pregnant women. Pregnant women who are exposed to measles should undergo post-exposure prophylaxis with immunoglobulins. And if pregnant a woman gets measles, is diagnosed with measles, require close monitoring and supportive care to manage symptoms and reduce the risk of complications for both mother and fetus. So, measles and HIV. There is increased risk of HIV positive individuals, um, especially with weakened immune systems. They are at higher risk for severe measles and its complications. And challenges in diagnosis and treatment in HIV patients is that atypical presentation of measles, reduced vaccine efficacy, and persistent viral shedding. Management in HIV positive individuals need close monitoring and may require additional treatments or immune support to manage complications. Measles and malnutrition. This is a bi-directional relationship, as malnutrition weakens the immune response, increasing the severity of measles, and measles exacerbate malnutrition by causing diarrhea, anorexia, and increased nutritional demands. And a vitamin A deficiency occurs that leads to keratomalacia and blindness in severe cases, and is associated with higher mortality from measles complications. Diagnosis of measles is clinical and also based on the laboratory test. Clinical features, the key features are fever, maculopapular rash, and complex spots. In the laboratory test, we can go for serology. That's the detection of IgM antibodies and appears around 3 days post rash. We can also go for PCR that detects viral RNA from throat swabs or blood. Vaccination. Measles vaccine is administered as part of the MMR, measles mumps rubella combination, and the vaccination type is live attenuated vaccine. And schedule in Pakistan is it's a two-dose vaccine. The first dose is administered subcutaneously at 9 months of age with a dose of zero point 0.5 ml, and the same dose and route is followed in the second dose as well at 15 months of age. So you can see that 9 months and 15 months is the time for measles vaccine. 93% efficacy of this vaccine is achieved after one dose, and 97% is achieved after two doses, ensuring strong protection against measles. Immunoglobulin, measles specific immunoglobulins are used for post exposure prophylaxis, and these are given to the infants under 6 months, pregnant women, and high risk groups. When should they be administered? They should be administered within 3 to 4 days, but a maximum of 6 days of exposure to the measles virus for maximum effectiveness. This should be followed by live measles vaccine as well in 8 to 12 weeks. The dose is 0.25 ml per kg of body weight. So, role of vitamin A in measles management. WHO recommends routine vitamin A supplementation for children with measles. Dose for less than 6 months children is 50,000 international units. For children 6 to 12 months, it's 1 lakh international unit, and for children more than 12 months, it's 2 lakh international units. Vitamin A enhances epithelial integrity, boosts immune response, and reduces severity of complications. And studies have shown that there is 50% reduction in mortality among children receiving vitamin A during measles. So, prevention of measles, primary prevention includes vaccination and public awareness. The most effective method of primary prevention is vaccination. Ensuring all children receive the MMR vaccine on schedules helps prevent measles spread. And public awareness, educating communities about vaccination and measles risk increases coverage as well and reduces the outbreaks. Secondary prevention includes early detection, that's prompt identification of the clinical features that helps prevent transmission and ensures better management and isolation. Isolating infected individuals during the infectious period, that is 4 days before and after the rash, to prevent spread, especially in the healthcare settings. Post-exposure prophylaxis, administer measles-specific immunoglobulin within 6 days of exposure to the high-risk individuals, as discussed before. So the tertiary prevention, includes the management of complications. We should give IV fluids to manage dehydration from diarrhea, respiratory distress. We should give antibiotics to treat secondary bacterial infections like pneumonia. We should give vitamin A that reduces complications and enhances immune function. Rehabilitation support for individuals with long-term effects like hearing loss and neurological damage to improve their quality of life. And follow-up care should be given ongoing monitoring for severe complications to manage secondary infections and long-term health issues. Control measures include case identification, rapid diagnosis of the suspected cases, and a prompt isolation of them, mass immunization campaigns, conducting the vaccination campaigns targeting unvaccinated populations, particularly in areas with low vaccine coverage, to quickly halt the spread of the outbreak. Then, contact tracing, identifying individuals who have been in close contact with an infected person and offering vaccine to those who are unvaccinated or at high risk. There should be enhanced surveillance and reporting system. Global burden of measles, as per the data of 2023, annual cases were 9 million and deaths were around 1 lakh and 28,000 among the unvaccinated individuals, and sub-Saharan Africa and Southeast Asia experienced the highest burden. As per the data of 2025, 1,753 confirmed cases were reported in United States. This data is taken from the website of CDC, and they said that there have been 45 outbreaks reported in 2025. According to the data of WHO, this data is for the year 2025. These are the top 10 countries with measles outbreaks, and Pakistan has the number of cases around 11,463, and it's on number 3. Measles associated mortality at high risk groups, children under 5 years, and pregnant women and immunocompromised individuals. Leading causes of death are pneumonia, 50% of deaths occur due to pneumonia, diarrhea in malnourished children, encephalitis, high mortality, or permanent neurological damage in survivors. Elimination of measles means no endemic transmission of measles in a specific region for at least 12 months, and key requirements for this are 95 or more than 95% vaccination coverage with two-dose measles vaccine, robust surveillance system, and rapid response to imported cases to prevent local transmission. Eradication of measles means permanent worldwide interruption of measles transmission leading to zero cases, and the key requirements for this is highly effective measles vaccine, no non-human reservoir of the virus, and strong public health system surveillance and outbreak control. Milestone achieved towards global measles elimination. Um, in 2000, WHO launched a global measles strategy, and in 2010, introduction of the measles rubella initiative to strengthen vaccine campaigns globally. In 2019, measles deaths reduced by 73% compared to 2000. In 2021, the global vaccine coverage estimated at 81%. That's far below the 95% needed for herd immunity. And current goal is to eliminate measles. Challenges for the elimination are the vaccine hesitancy, limited healthcare access, weak immunization, infrastructure and cold chain issues, and political instability and conflict zones. WHO Measles and Rubella Initiative, the goal of WHO is for the global elimination of measles and rubella by 2030 as part of the Measles and Rubella Initiative, and this initiative aims to reduce measles death by 95% and eliminate rubella in all regions. So strategies, as already discussed, are the vaccination, surveillance, and outbreak response. This is a case study that America measles elimination in 2016. The America became the first region to declare measles eliminated, but we have seen now that there are cases of measles appearing in that region. now in 2025. Measles elimination efforts in Pakistan include WHO collaboration. There have been 2000 in 13 and 14 there were outbreaks of measles. Um, Natural disasters and ongoing vaccine hesitancy are among the challenges to eliminate measles. So the recent updates. And this is the data published by WHO that there have been a lot of cases of measles. This is a study published in Sindh, Sero Surveillance of Measles Virus Seropositivity amongst vaccinated children of rural areas of Sindh. It states that serum samples were collected from 173 children, and was done on that samples, and the study recruited children with an average of age of 41.3 months, evenly split between males and females like 88 and 81 respectively, all vaccinated as per their parents' records. The measles IgG antibodies seropositivity ratio in children among the vaccinated population was 53, and seronegative was 120 out of 173. So the study revealed alarming rates of measles susceptibility among vaccinated children in Pakistan. This is a study measles seroprevalence in adolescents and young adults living with HIV and response to MMR booster in seronegative ones. So the study analyzed people with HIV, measles seroprevalence, and response to MMR booster given to the seronegative individuals. They identified that an MMR booster dose must be sought during adolescence in the vertically transmitted HIV. So this was a campaign recently done in Pakistan, and WHO published it on their website. Pakistan launches nationwide measles rubella vaccination campaigns to protect 34 million children. Measles and Rubella Strategic Framework for 2021 to 2030. Um, um, in collaboration with Measles and Rubella Initiative, American Red Cross, CDC, UNICEF, United Nations Foundation, and WHO. So their strategic priority is to strengthen primary health care and universal health coverage. And the vision is a world free of measles and rubella. The core principles as are the plan will be people focused, country owned, partnership based, and data enabled. So now comes the time for practice of MCQs. Question number one, a refugee camp with overcrowded living conditions reports a surge in measles cases. Investigations reveal that infected individuals are spreading the virus through coughing and sneezing, with cases occurring even in distant parts of the camp. What mode of transmission is primarily responsible for this outbreak? Option A, fecal-oral transmission. Option B, direct contact with infected skin lesions. Option C, airborne spread of respiratory droplets. Option D, vector-borne transmission via mosquitoes. And option E, contaminated water supply.
C.
C.
Yes, option C is the
Droplet
correct one.
infection.
Question number two. An unvaccinated 8 months old baby is brought to the hospital with fever, cough, and a maculopapular rash. The mother reports that older siblings recently had measles, which host factor most likely contributed to the baby's susceptibility to infection. Option A, poor hygiene practices in the household. Option B, the baby's young age and lack of vaccination. Option C, overcrowding in the home. Option D, nutritional deficiencies in the family. Option E, exposure to multiple environmental triggers.
E.
B. B.
Yes, option B is the right one. Question number three. A 6-year-old child presents with high fever, cough, runny nose, and red watery eyes. The mother reports these symptoms started 2 days ago, but no rash is visible yet. On examination, small white spots with a red base are seen inside the cheeks. What is the significance of these spots? Option A, they confirm the child has a bacterial infection. Option B, they indicate the child is in the incubation phase. Option C, they suggest the child is immune to measles. Option D, they are characteristic of the prodromal phase of the measles. Option E, they are a sign of scarlet fever.
D.
D. Option D.
Yes, option D. Question number four. A 4-year-old unvaccinated boy develops a high fever and respiratory symptoms. 3 days later, he has a maculopapular rash spreading from his face to his limbs. His parents asked how long the rash will last. Uh, what is the typical duration of the rash phase in measles? Option A 3 to 4 days. Option B 4 to 6 days. Option C 5 to 7 days. Option D 6 to 8 days. Option E more than 10 days.
Uh, option C and option E,
Option
please.
A is the right answer, 3 to 4 days. Question number
Okay.
5. Years after recovering from measles, a teenager begins showing progressive neurological symptoms, including seizures, behavioral changes, and loss of motor skills. MRI findings indicate inflammation in the brain. What delayed complication should be suspected? Option A meningitis, B GBS, C stroke, D viral encephalitis, E subacute sclerosing panencephalitis.
E.
Yes, option E is the right one. Question number 6. A pregnant woman in her first trimester has close contact with someone diagnosed with measles. She is not immune as she was never vaccinated. What is the best preventive measure for her to avoid contracting the disease? Option A. Immediate administration of the measles vaccine. Option B. Administration of measles immunoglobulin within 72 hours of exposure. Option C. No preventive measure is required. Option D. Starting antiviral therapy immediately. Option E, post-exposure prophylaxis with antibiotics. B is the right answer. We should
B.
administer immunoglobulins.
B.
Question number 7. A child with measles is admitted to the hospital with a high fever and pneumonia. The child's nutrition is poor and they have a non-deficiency in vitamin A. What benefit does vitamin A supplementation provide in this case? Option A, it will shorten the duration of the rash. Option B, it will completely prevent the development of complications. Option C, it will prevent secondary bacterial infections from occurring. Option D, it will cure the measles infection immediately. Option E, it will reduce the severity of pneumonia and support immune function.
B.
B.
Option E, it will reduce but not completely prevent the development of complications. Question number 8. A 4-year-old child with a history of measles and subsequent complications such as hearing loss is referred for long-term care. The healthcare providers advises on auditory rehabilitation and regular follow-up visits. Which type of prevention is being applied in this case? Option A, primordial, B, primary, C, secondary, D, tertiary, E, quaternary.
D.
D.
Yes, D,
Tertiary.
tertiary prevention. Question number 9. A country is struggling to eliminate measles despite strong efforts with periodic outbreaks occurring in urban slums. Investigations show that many residents have not been vaccinated due to lack of trust in the healthcare system. What challenge does this scenario highlight in achieving measles elimination? Option A, misinformation about measles and vaccines. Option B, inadequate supply of vaccines. C, inadequate funding for vaccination programs. D, lack of infrastructure for cold chain management. E, ineffective national vaccination policies.
E.
A.
Yes, option A is the right one. Question number 10. In 2016, WHO declared that measles transmission had been eliminated in the America. What was a key factor in achieving this milestone? Option A, introduction of a universal vaccine for all infectious diseases. Option B, limited international travel to and from the region. Option C, widespread measles vaccination and successful immunization campaigns. Option D, sorry, strict travel bans on individuals from countries with active outbreaks, and option E, complete eradication of the measles virus from wildlife.
D.
Option C is the right one. Widespread measles vaccination and successful immunization campaigns. So this is the answer key. This is the YouTube channel of Institute of Public Health where this presentation will be uploaded. Thank you.
Thank you very much, Amna.
So,
Would you please go to the slide where you have mentioned about the complications of measles, please?
Yes, ma'am.
Okay. Would you please,
Sorry, ma'am. I think I'm
you have missed.
right, ma'am.
Right. This is the incomplete list because we know that the measles is one of the disease that can be life threatening. It has early complications and the late complications. So you must add more in the complications of measles. Right. Where is acute pancreatitis? Next, please.
No, ma'am. Acute pancreatitis is not mentioned. I will add it later on.
Okay. So the measles is one of the disease, as you have mentioned about the delayed complications or the late complications. So how much time is required for the delayed complications to appear? For
Ma'am,
example,
I
the
will check
subacute
it and
sclerosing panencephalitis. Yes, it is one of the disease that can even appear, as the literature has mentioned, even after many years. This child may get the subacute sclerosing panencephalitis even after many years, even after 4 years or 5 years of the initial infection. And it is a very slow occurring disease. This is why it is called subacute, and it leads to the narrowing of the channels that is for the CSF flow. So it leads to inflammation. There are antibodies to the measles virus, and that antibodies continue to produce inflammatory response, and the child may get the less IQ level, and they would have the symptoms of degeneration of the neurons, and decreased memory and decreased motor skills. So this type of the disease can occur even after many years. It is different from the other forms of encephalitis because it has the all the parts of the brain involved, and this leads to the continuous declaration over time, and it is only through the thorough history one can diagnose it. So overall it is a very good presentation, and you have touched each and every component in good detail. Only few points have been missed, so I would request you to please enter about acute pancreatitis, as because it is also a life threatening condition, and the encephalitis again a life threatening condition, so that should also be added. As we have the measles and rubella campaign going on, and the vaccines are available free of cost to all the children who need them. So the patients as well as the parents and the relatives should be encouraged to have more and more participation in these vaccination campaigns. So thank you very much, Amna.
Right, ma'am. Thank you, ma'am. I will add all these things.
Thank you, Amna. It was a very good presentation, Bitta.
Thank you, ma'am.